There are three main joint types: synarthrosis, amphiarthrosis, and diarthrosis. Symphyarthrosis is when there is no movement and is composed of fibrous joints that are made of dense connective tissue and collagen. Sutures are a type of fibrous joints that are in the skull. Gomphyarthrosis, which is the teeth, is also a fibrous joint, and so is symbiosis, which is your tibia and fibia when they rub together. Amphiarthrosis, which is slight movement, is composed of cartilage joints that is made by cartilage and prevents most of movement, but not all. These composed of the cartilaginous joints are the zichondrosis, which is your sternum and ribs that connect it there through the costal cartilage, and a temporary one is your epithelial plate. Symphysis, cartilaginous joints, which is your vertebrae that allow for moving of your vertebrae. And lastly, diarthrosis, which is free movement, is composed of synovial joints, which is a joint cavity consisting of liquid like your knee or your elbow. These are your ball and socket joint, where it's ball and socket and it rotates, your gliding joints, which is also known as a plane joint, where they slide across. Saddle joints, where one is like this and the other one is like this, that prevents forward and backwards and side to side movement, but no rotation. And then hinge joints, which is like a door and you hinge open or closed.
Okay, so extension is when you move your arm away from the body, and this can also be considered abduction. And then hyperextension is if you like move your leg behind your body, or if you like stretch your body backwards. Plantar flexion is when you point the foot down, and then dorsiflexion is when you point the foot up. And then abduction, like I said, is moving arms away from the body, but it can also be like moving your legs kind of away from like the midline of the body. Adduction is when you bring, if they're up, then you bring your arms back down. Circumduction is when you move arm, you can move your arm in a circle, or you can move your leg in a circle. And then rotation, you can turn your head in both directions. Supination is when you place your palm up, and then pronation is when you put your palm down. And then eversion is when you tilt your foot outward. And then inversion is when you tilt your foot inward. So.